All right, Dr. Redlener, thanks so much for taking some time to speak with us here today. Let's start with the CDC, the wording on their vaccine safety portion of their website, changing it. What is your reaction and perception of what they did and what the impact is?
Well, yeah, it's actually been a very interesting thing to follow. I just want to read to you exactly what the title of the section in question is. It says, "Vaccines do not cause autism." And that's been the heading on a section that's been around for quite a long time. And then the section goes on to say that there is no problem with the safety of the vaccine and no evidence suggesting that there's any relationship between vaccine and autism. This has been what's been the standard line from the CDC for a long time. But a few days ago, the Secretary of Health and Human Services, Robert F. Kennedy Jr., personally had a hand in changing the text of that section. So the title remains the same, except that instead of saying in the text that the vaccines, there's no relationship, he now says there is no evidence to establish the fact that the vaccines are safe or that they do not cause autism. So it's really the problem now, Tom, is that it actually undermines people's confidence in vaccine. They could have gone to the CDC a week ago and found, reassurance that things are fine. Now they find confusion and uncertainty based on really nonsense. This is a conspiracy theory that there still is a relationship between vaccines and autism. It's been over and over again disproven. And it's part of a larger campaign to undermine vaccine confidence in general.
When it comes to that wording that they changed it to, it says the studies have not ruled out the possibility that infant vaccines cause autism. I guess is that a play on words around? I guess are they trying to work around what it was before? Because I
Yeah.
guess technically you could say that they're not untrue, but there's other. I mean, they're not including the full context, I guess.
Well, it's actually very misleading to say that there's any doubt about the relationship between vaccine and autism. And once you sort of plant that doubt, it just reinforces, you're a parent and you feel like, okay, I'm going to go get my shots for my children. But, I've been hearing so much about vaccine safety. Let me go to the website of the CDC. It's supposed to be a credible scientific information that's available to me. I go there, I'm still uncertain. It's like when Kennedy and Trump from the White House a month and a half ago said that Tylenol in pregnancy to control pain could potentially be linked to autism in the baby. It was preposterous. And it's just another piece of the strategy to make people feel uncomfortable about vaccines. Kennedy is a well-known anti-vax, anti-science conspirator now with the largest public health platform in the world. So what he says matters. He cannot be marginalized. And the best we could do is keep saying, he just said this, it's not true. Parents, as a pediatrician, yeah, you should be very comfortable. I've vaccinated my own children. My grandchildren are vaccinated. It's completely safe, and there's no relationship to autism. So that's where we stand right now with that.
Why is this step, I guess, different or than what's already you mentioned the press conference at the White House regarding Tylenol, and we already know we've already heard Robert F. Kennedy Jr. speak on this in a variety of platforms. But to go to the website now and change that wording, how substantial is that in your
Yeah,
eyes?
no, it's really substantial because, a person who really wants to get into this, I got my new baby, we're due for shots, but I'm hearing all kinds of questions about the safety. So what do I do now? Do I actually get the shot or not? I think I'll go to the CDC website. The CDC for my entire life has been the credible resource for information about vaccines and infectious diseases. So you look up vaccines safety, you come to that heading about vaccines and autism, and two things happen. One is the reading the text now makes you increasingly concerned. Maybe there is a problem. The second thing is that the title now has an asterisk associated with it. And the asterisk leads to a note that says, basically, this is here because Senator Cassidy told us we had to keep the title the same. And the whole thing is a fabricated kind of rationalization for trying to promote anti-vax, anti-science theories that really unsettle parents, and for good reason.
We've already seen some data come out since this administration has come on about vaccines and illness, right? I mean, this is already having an impact in terms of this
Yeah.
messaging, you could
Oh,
say.
yeah. Two major outbreaks for childhood illnesses that had been literally eradicated. And one of them, of course, is measles. And very shortly after Robert F. Kennedy's policy started to take effect, and we started to see erosion of the public's confidence in the vaccine, we've had measles outbreaks. In fact, we've had more measles cases now already in this year since any year since measles was designated as eradicated 25 years ago. So we're seeing definite outbreaks of measles, but the other disease now we're seeing outbreaks of is whooping cough. We call it pertussis. It's a deadly disease that used to kill a lot of babies and children before 1948 when we developed a whooping cough vaccine, which is part of the routine vaccinations now. No one's really ever heard of it. It's a horrible disease where kids get short of breath, they can turn blue, and it could have very, very critical consequences, including death. So here we are now with vaccine confidence dropping, thanks to Robert F. Kennedy and others. We have now outbreaks of whooping cough in addition to the outbreaks of the measles. It's a terrible direct consequence of undermining people's feeling of that the vaccines are safe.
I think some of the questions about vaccines and autism probably comes from parents who are wondering, why for some reason their child might be on the spectrum, right? And maybe they're not getting the answer that they're looking for. I guess what is your answer to that when it comes to parents that are wondering, okay, what happened here, or what are some of the
Right.
links to this?
And listen, the reality is, Tom, as you say, there are parents of children with autism who say, "I think there's a relationship. I got my kid the shots, and then, 2 months later, they're having symptoms of being on the autism spectrum." These are legitimate concerns, which is why science has looked into it. And unfortunately, like 20 years now or something, as somebody, a doctor in the United Kingdom, wrote a published scientific paper said, "Oh yeah, I think there is evidence to suggest that autism can be caused by the vaccine," except that he made up the data. It was absolute BS, and it got published. The authorities realized it was fake data. They pulled the article from the literature, and then the guy lost his medical license. So this is basically a bogus study that has caused an enormous amount of damage over the years. And many, many, many studies, like almost 6 million children have been involved in studies in over 7 countries, establishing the non-existence of a link between vaccines and autism. It just is not true. There are many other factors that might be at play here. A lot of them are genetic. There are certain genetic predilections that may make some children more susceptible to autism. There may be some environmental factors. We don't know. And by the way, the anti-vax crowd likes to talk about the big increases in the prevalence of autism lately. Well, the problem with that is that not really. When we were first looking at that data, we were looking at kids with very severe autism, kids that couldn't speak at all. They had no social skills whatsoever. Then we said, it's actually more than that. There's a whole spectrum. There's highly successful people with autism on the lower end of the spectrum. So we increased what we include in the diagnosis so the numbers look bigger. But it's not because of an outbreak or more cases. It's because of a changing definition of the autism spectrum.
Does there need to be more reporting of any adverse events that come from a vaccine? Does there need to be more oversight of that at this point? Because I think that's something else those groups have pushed for at the end of the day.
Yeah, well, there's actually a lot of oversight, and doctors are absolutely required to report any kind of complications. Parents also have a way of reporting potential connections or issues they have with vaccines. So it's not like that's not been paid attention to it as has been. Um, so I mean, you could always ask for more, but I mean, we're talking about the entire world scientific community has been looking at this for decades. And I can say with absolute confidence, as a pediatrician, that listen, it's safe. So if you're a parent, you're listening to me, and I'm telling you, my own kids were vaccinated, my grandchildren are all vaccinated, and I certainly wouldn't be considering it if there was any real worry about something like autism happening. The overall effect of the vaccines is saving lives from the diseases that you never even heard of because they've been eradicated. And this is something that we just have to face this reality and try to figure out how to neutralize the conspiracists who are making these connections when there's no basis for it.
Back to sort of where we started when it comes to the CDC itself, I guess where do you see it and where do you see this going when it comes to the messaging and the organization, I guess you could say, from the top at the end of the day here?
Well, the CDC, the Centers for Disease Control and Prevention, is an agency of Health and Human Services, HHS. Bobby Kennedy Jr. is the boss of that agency. So the people that run the FDA, which is looks at our drugs and our Medicaid and Medicare agencies, and the CDC all report up through Robert F. Kennedy Jr. He has hired people to run each of those agencies that are completely in his, realm of thinking that, the science is inadequate and that, we're looking for conspiracies around every corner. So the CDC leadership, and by the way, we're about to see a new candidate to head the CDC that Robert F. Kennedy Jr. is promoting, who's also got all kinds of questions about her credentials and all that. So we have a lot of problems. The conspiracists, the MAGA cult has infiltrated all of our major health agencies now, and it really is a problem. And I see in the CDC demoralization, disorganization, loss of staff, and loss of funds, including, by the way, NIH, with our major research entity, also under RFK Jr., also has been decimated by this crew here. So we got problems up and down the line health wise, but hopefully we'll see some changes.
Yeah, Dr. Redlener, thank you for the time. I appreciate it.
Of course, Tom, thank you.